I'm Peter Turk. I'm a surgeon, surgical oncologist, meaning I took an extra 2 years of fellowship training at Brown University and was on staff up there for a year before coming to Charlotte 19 years ago.
Okay.
And my practice has grown and changed with that time. The practice I have, I usually meet patients here. This is their conference room, and I'm very comfortable with that. And I think that's something that needs to be done with patients, be it with a gallbladder or a hernia patient, or if it's a patient with a new cancer, just being able to sit and discuss the prognosis, discuss the diagnosis, discuss how we get from here to there with hopefully a cure being at the other end. But there has to be a comfort level between the patient and the physician. And I think that that's something that can't be completed with a PA or a nurse practitioner, unfortunately, and our practice works that way, where it's strictly with the surgeon and the patient. And if you call our office, you're going to get somebody answering the phone. They're not going to get a computer. So we feel what we thrive in is interpersonal relationships, because that, for us, is what life is all about. It's people. As far as the treatment of cancer, it really, I feel, is a real blessing to be able to interact with people in this way, because I see people very stressed, and it's one where we write things down because you leave the office and you can't remember anything I said, but at least you have something to go home with and review, and a card of mine that says, if you have any questions, call me, because there will be questions. What we want as you go through the process of a diagnosis and treatment of cancer is an understanding of what you're dealing with. So you're really driving the decision making. So you don't feel like you're being victimized first by the diagnosis and then by the treatment. So when Aunt Marge calls and says, well, why didn't you do this or do that? You'll know why you didn't do this or that. Or if you don't know, you'll call me and say, why are I doing this and that? And then we can work it through so you understand. Because if someone tells me something about my car, I have no idea what they're talking about, but I have to trust them. It's the same thing here. But I will ask questions, and I really want patients to ask questions as well, to know why we're doing what we're doing. It's just a foreign language until you understand. But there is an opportunity to grasp what you're dealing with. And even if it's a bad diagnosis, there's less stress when you understand it than all of a sudden falling into this big black hole when you're diagnosed with a very difficult diagnosis. And what do you do from here? At least we'll have plans. In a lot of cancers, we have more than just me involved. There's going to be pathologists, there's going to be radiologists, there's going to be medical oncologists, the people that do the chemotherapy or the hormone therapy. There are radiation oncologists that do the x-ray treatments. So there's a lot of people involved. It's not just, you trust me and we'll take it to the other side. There's a lot of interaction, a lot of different people involved. And oftentimes we have navigator nurses from the hospitals that will help us with that as well. So it's not like it's a solo journey. Hopefully you have family or friends or a church that will be good support, but we also will offer support to get you moving the right direction, again with less stress, hopefully each step of the way.